Good morning, students. Today, the topic which we are going to discuss is music therapy and couple therapy. The learning objectives of today's topic are music therapy. You will able to understand the meaning of music therapy, advantages of music therapy, what are the different advantages of organizing a music therapy, indications of music therapy, what are the different indications of music therapy, types of music therapy, different types of music therapy which can be used by the therapist. The next, you will able to define the couple therapy, meaning of a couple, characteristics of happy couples, and goals of therapy or goals of couple therapy. Music therapy. Music therapy introduction. Music therapy is a type of therapy where forms of musical interactions and communications are used alongside verbal communication. Means musical interactions and communications are used alongside verbal communication. Systematic process of interventions wherein the therapist help the client to promote health, where the therapist will help the client to promote health using music experiences and the relationship developing through them. Now, advantages of music therapy. Music can help you to fight with stress, find comfort, and manage pain. Means music will help you to fight with the stress. It will give you the comfort that you are finding out and manage pains. Women planning virginal childbirth are usually encouraged to bring along music that will help them to relax during their labor. It increases relaxation, means the music therapy will relax a particular individual. It reduces loneliness, means the music will help or the music therapy will help an individual to reduce their loneliness. They will not consider themselves to be an isolated. It enhances spiritual connection, means the music helps to enhance the spiritual connection between the individual, help in fight with depression and anxiety. The music therapy will help an individual to fight with the depression and anxiety, facilitates emotional expression, improves cognitive skills like learning, listening, and attention span. Social interaction is stimulated. Now, the indications: psychotic disorder, schizophrenia. It's a group of psychotic disorder and it leads to social, emotional, and occupational deterioration of a particular individual. Schizoaffective disorder, drugs induced psychosis. Mood disorder, major depressive disorder. That person will consider to be a depressive. Bipolar disorder, developmental disorder, autism, and mental retardation. Neurological disorder, dementia, Parkinson diseases. Now, types of music therapy. Background music therapy. It is a form of therapy in which music is heard for an average of 8 to 12 hours per day. Means it's a form of therapy in which the therapist will make a client to heard music for an average of 8 to 12 hours per day as part of a hospital routine. It is transmitted via audio tapes and radio, means that music will be transmitted to the patients through audio tapes and radio. The aim of this therapy is to create a calm environment in the hospital. Mu- the music will help to create a calm environment in the hospital. Contemplative music therapy. It helps the patient to appreciate the significance of music and art in general. Means it will help the patients to appreciate the importance of music and art in general. Before music is played for patient, they are given a biography of the composer and other details about the music. Means before the session will start, the therapist will give the patient a biography of the composer and other details about the music which he is going to play. This can be administered in group settings or individual. Means the contemplative music therapy can be given in group or to a particular individual. Now the next one is combined music therapy. It is used in conjunction with other therapeutic procedures. Unlike background music therapy, it calls for the patient to select musical compositions that enhance musical outcome and suit the patient. Sometimes, in this form of musical therapy, hypnosis is conducted with the subject listen to the music. This form of music therapy has been used in combination with cerebral electro sleep therapy and behavior therapy. The next one is executive music therapy. It consists of individual or group singing and playing musical instrument. Now, when we are talking about the executive music therapy, in which the patients or the clients are singing and playing musical instruments. Patients with long hospital stays are the best candidates for this form of therapy. Means those patients who are staying long in the hospital are considered best candidate for executive music therapy. Executive Itomosic music therapy. In this therapy, a musician performs in children's psychiatric units. A musician will be called and he will perform in child psychiatric units. This form of therapy frequently is used in managing emotionally disturbed, mentally retarded, and dyslexic children. Means executive iotronic music therapy will be used to manage the emotionally disturbed, mentally retarded, and dyslexic children. Now, the next one is creative music therapy. In this, a patient write a song. In this, a patient is asked to write a song, compose music, and to compose the music of that particular song and play instruments as a form of catharsis. In this, repressed feeling of fears to be expressed in music and song. Now, in this, the therapist will ask the patient to express their repressed feelings of fear through the medium of music and song. Now, discussion: how will you practice music therapy in clinical practice? As a psychiatric nurse, how will you improve the communication within the family? Effectiveness of a music therapy intervention on relaxation and anxiety for patients receiving ventilator assistant. Objective: to test the effects of music therapy on relaxation and anxiety reduction for patients receiving ventilator assistant. Means you have to test whether the music therapy is giving relaxation to the particular individual and help in the reduction of anxiety. Design: two group pre-test post-test experimental design with repeated measures. Subject random to either a 30-minute music condition or a rest period. Setting: four urban Midwestern intensive care units. Subject: 54 alert non-seated patients receiving mechanical ventilation. Outcome measure: state anxiety pre-test and post-test, heart rate and respiratory rate obtained every 5 minutes for 30 minutes. Results: subject who received music therapy reported significantly less anxiety post-test than those subjects in the control group. Heart rate and respiratory rate decreased over time for those subjects in the music group as compared with the control group subjects. Means a pre-test post-test experimental design was used by the researcher, and he has created two groups. The one is which is given as music therapy and is regarded as the experimental group, and the other group who will not receive the music. Before that, the researcher has conducted a pre-test on both the groups, that is the experimental group and the control group. After hearing the music, the experimental group significantly shows less anxiety in comparison to the control group who has not given the musical therapy. Conclusion: a single music therapy session was found to be effective for decreasing anxiety. Means the results are concluded that a musical therapy session was found to be an effective for decreasing the anxiety and promoting relaxation, and it will relax the patient as indicated by decrease in heart rate, as in shown that that patient has decreased their heart rate and respiratory rate over the intervention period with this sample of patients receiving ventilatory assistance. Now, the next topic which we are going to discuss is couple therapy. Now, definition of a couple. Now, what do you mean by a couple? Couple mean two of the same sort considered together. We are more concerned with the definition that two people who are married or have a romantic or sexual relationship. Now, characteristics of happy couple: foundation of affection and friendship, validation sequences, ability to resolve disagreements, positive sentiment override. A 5 to 1 or better compliment criticism ratio is optimal. As the ratio decreases, marriage satisfaction decreases. Amount of conflict relatively unimportant. Now, couple therapy. It is related and different process. It may differ from relationship counseling in duration. Short-term counseling may be between 1 to 3 sessions, and we are talking about the short-term counseling sessions for a couple. It can range from 1 to 3 sessions, whereas long-term couple therapy may be between 12 and 24 sessions. And we are talking about the long-term session or the long-term couple therapy sessions, it can last from 22 to 12 to 24 sessions. Now, goals of therapy: help partners negotiate behavior change. Means the therapy will help the partners to negotiate behavioral changes. Teach more effective communication skills. Means the therapy will help them to learn the more effective communication skills. Example: active listening, how to argue. Avoid the four horsemen and other forms of destructive fightings. How to avoid themselves from the destructive fighting. Focus on and encourage positive sentiment over right. It will focus and encourage among the couple the positive sentiments over right. Improving communication skill. The therapy will work on how to improve the communication skill. Now, assessment of marital distress. Couples can be assessed along behavior, cognition, effect, and internal dynamics. First, understand the characteristics of unsatisfied couple. First of all, you have to understand what are the characteristics of an unsatisfied couple. Then prevent and treat dissatisfaction. Then you have to prevent those characteristics and treat dissatisfaction among them. Distressed couples show high rates of the four horsemen: defensiveness, criticism, contempt, stonewalling. Now, treatment approaches: behavioral, marital, couple therapy, origin in behaviorism, and is a form of behavior therapy. Means you have to change your behavior. The maladapted behavior should be replaced by effective behavior or the correct or the appropriate behavior. This theory is rooted in social learning theory and behavior analysis. The purpose of behavioral couple therapy (BCT) is to build support for abstinence and to improve relationship functioning among married or cohabiting individuals seeking help for alcoholism or drug abuse. Integrative behavioral couple therapy consists of two major phases: an evaluation feedback phase and an active treatment phase. The typical course of therapy lasts between 6 and 12 months. Emotion focused therapy (EFT). It is a unique, empirically based approach based on methods designed to help people accept, express, regulate, make sense of, and transform emotion. Means if it is based on an approach, or we can say based on methods, and these methods are designed to help people accept what others are saying, express, to express themselves, regulate and make sense of and transform emotions. Learning about emotions is not enough. Means you have the knowledge about the information is not enough. Instead, what is needed is for clients to experience those emotions. Learning about the emotions is not enough, but it is need that the client to experience those emotions as they arise in the safety of the therapy session, as those emotions arise in the safety of the therapy sessions. Couple and marriage counseling. Couple or marriage counseling is offered to support people in relationship. Means the therapy or the counseling will help support to the people who are in relationship, who may be considering separation or seeking improved intimacy and understanding, who are considering that they have to be separate or seeking improved intimacy, how to improve the intimacy and understanding between them. People in relationship seek counseling for any number of reasons. Means counseling, people are seeking counseling for many reasons. From power struggles and communication problems when they are having problems related how to communicate, to sexual dissatisfaction and infidelity. True counseling is recommended as soon as discontent arises in a relationship. Means the person must go to a counselor as soon as discontent arises in a relationship. Study shows that on average, partner will not seek therapy until they have been unhappy for 6 years. Five principles of effective couple therapy. Means there are the five principles which are considered effective when a therapist is going to give couple therapy to a particular individual or couple. The principles, the first one, change the view of the relationship, modifies dysfunctional behavior. They have to change that particular behavior, decreases emotional avoidance, improves communication. How to improve the communication or how to improve your communication skill? Promote strengths. Couple counseling techniques. The first one is got man method. Use couple counseling technique to increase affection, closeness and respect. Means in this method or in this type of counseling technique, it was used so that it will increase affection, closeness and respect for other member. This technique help you resolve conflicts when you feel like you are at an impasse. Uh, this technique will help you to resolve conflicts. Show you how to build love map. This technique will help you how you can build love maps, which help you learn about your partner's psychological world. And this technique will help you to learn about your partner psychological world. By mapping your partner worries, when you will start mapping your partner worries, stress, joys, hope, and history. It stresses means giving importance, conflict management rather than conflict resolution. Means it is giving importance how to manage the conflict rather than conflict resolution. The second one is narrative therapy. Narrative therapy seek to separate the problem from the person by externalizing issue of concern. Means it this type of therapy will work to separate the problem from the person. Means it will work how to separate the problem from the person by externalizing issues of concern, and uh, the problem will be separated from the person by externalizing issues of concern. It allow you to gain new perspective on the situation. Means the narrative therapy will allow a particular individual that they will gain a new perspective on the situation. Narrative therapy allow you to explore the past to bring to light negatives that otherwise remain hidden. Means that therapy will allow you to explore the past to bring to light negatives that otherwise will remain hidden in your mind. The third one is emotionally focused couple therapy. Was first developed for couples. Is emotionally focused couple therapy was first developed for couples, but it has proven useful for family counseling as well. But emotionally focused couple therapy was not only useful for giving therapy or counseling to the couples, but it also useful for family counseling, and there also it being considered as very useful. Emotionally focused therapy has three main goals. When we are talking about the emotionally focused group therapy, couple therapy, we are saying that this therapy has three goals. The first one is encourage the expansion and reorganization of key emotional responses. Means we have to encourage the expansion and reorganization of key emotional responses of other person. Seeks to secure a tight bond between you and your partner. Seeks to secure a tight bond between you and your partner. Distance during interactions and create new beneficial interactions in your partnership. Distance during interactions and how to create new one and a beneficial interactions in your partnership. Now the next one is positive psychology. Positive psychology emphasizes positive emotion, means it's given stress on positive emotions, character strength, and constructive institutions to promote the notion that happiness is derived from various mental and emotional factors. That institutions to promote the notion that happiness is being derived from various mental and emotional factors. Specialists believe perception dictates happiness from one event to another. The next one is Emoji relationship therapy. Emoji relation therapy combines spiritual and behavioral techniques. Means when we are talking about the Emoji relationship therapy, it is combining spiritual and behavioral techniques with Western psychological techniques of therapy to expose unconscious components. And with the help of that, we are able to explore the unconscious components. The therapists view the couple's conflict as a solution to the situation, and they will view the couple conflict as a solution to the situation rather than the problem. Examination of the conflict is the key to finding a solution to disharmony. Acknowledgement that each partner is communicating differently help resolve problems. That each partner is communicating differently will help to resolve the problems. Partners learn that disagreements are not sign of loss, but are normal occurrences in relationship that can be resolved through communication, and they come to know that communication is very important, and the communication can be used to resolve any discomforts or disagreements between them. Now, the next one is analyzing the way you communicate. The inability to communicate in healthy ways is the basis for the majority of problem in a relationship. Means you are not able to learn how to communicate with other members in a healthy way. And this inability to know how to communicate is the basis for the majority of problems in a relationship. It is important for you to speak your mind rather than to expect one another to read moods and body languages. You have to speak your mind rather you expect from other one to read your moods and body languages, which are open to misinterpretation. Means reading of your moods and the body languages may lead to misinterpretations. A therapist can guide you toward functional form of communication that elevate misunderstanding. Now the next one is exploring unconscious root of problem. The purpose is to bring the unconscious root of a problem to the surface, whether the problem belongs to one or both partner. You will come to know whether the problem belongs to both or to one. The belief of a psychodynamic counselor is that significant life events and childhood experiences shape people behavioral tendency. Means that significant life events and the experiences that a child get at early ages shapes behavioral tendencies. During couple counseling, the therapist explores major past experiences. He will explore the major past experiences in order to change distorted perceptions and eliminate irrational reactions to current events. Enhancing intimacy to promote closeness. Couple therapy is not just limited to deflecting or solving problems, means it's not limited to solve the problems of the couple. It also promotes closeness and intimacy in a partnership. It is not limited to solve the problems, but it also promotes closeness and intimacy in a partnership. Counselor help couples enrich their life. The counselor will help or promote in the couples so that they can enrich in their life by adding the development of friendship and ways to show affection. by adding the development of friendship among them and different ways to show their affection to each other, by providing exercises to increase mutual support. They will provide exercises so that it will improve, increase mutual support among them. Therapists teach couple how to overcome existing issues and how to make relationship resilient. Individual counseling. Individual counseling is recommended when one partner is unwilling to undergo therapy or as precursors to couples therapy. Individual counseling is recommended when one partner don't want or is unwilling to go for a therapy. A common issue with individual therapy arises with the client right to privacy. The best outcome can be expected when both partners are committed to counseling. The best outcome can be expected from a counseling when both the partners are committed to counseling. So, students, today we have discussed the music therapy and the couple therapy, the role of music to deal with the anxiety, depression of an individual. And then we have discussed about the couple therapy, what is the role of the couple therapy, and how the couple therapy will help the couples to understand better, to develop their affection and love. For further reading on this topic, you can refer these references or the bibliographies. Now let us discuss some MCQs, as MCQs are the best tools to know the learning outcomes of a learner, how much they have learned a particular concept. Now, the first one is, what is the process by which a system get the information required to correct itself? This self-correction is exerted either to maintain a steady state or to move towards a goal. Which one of the following best describe the self-correction process? Now the options are colon, feedback loop, family, homeostasis, or centripetal. Now the correct answer is option B, that is feedback loop. All of the following except for one are developmental models of family life. Who one is not a developmental model of family life? The options are the family projection process, the family life cycle, the family life spiral, or the family gram. So the correct answer is option A, that is the family projection process. Which one of the following developmental models has been described as an upside down trend? Now, these are the options, students: the family life cycle, the family life merry-go-round, the family life spiral, or the family genogram. So, students, these are the options. Now, you have to select the correct answer on the basis of the given choices, and the correct answer will be the family life spiral. Now, the next one, Georgi Batson described a classical example of the interaction between a mother and her son who had fairly well recovered from an acute schizophrenic episode. Weston described this interaction as follows: the son was glad to see her, his mother, and impulsively put his arm around her shoulder, whereupon she stiffed. He withdrew his arm, and she asked, "Don't you love me any more?" He then blushed, and she said, "Dear, you must not be so easily embarrassed, and afraid of your feelings." The patient was able to stay with her only a few minutes more, and following her departure, he assaulted an adult and was put in the tubs. Betson used this interaction to illustrate which one of the following concepts. The options are the cybernetic system, the homostatic system, the incorrigant family delay, the symphatic double bind. So these are the options, students, and the correct one will be the option D, that is the symbiotic double bind. Consider this statement: family therapists do not sit on the sidelines during therapy. Rather, they become involved with family members, pushing and being pushed. This statement best describes which one of the following family therapies. Now, the options are conjoint family therapy, strategic family therapy, structured family therapy, or transgenerational theory. So, these are the options, students. Now, you have to select the correct one on the basis of the given choices, and the correct answer will be structural family therapy. Now, the next one, consider this statement: individual, families, and entire culture are given a different level of power as creator for their relatives. This statement best describes which one of the following family therapies. Now the options are transgenerational theory, strategic family therapy, structural family therapy, or narrative theory. So students, these are the options. Now you have to select the correct answer on the basis of the given choices, and the correct answer will be, yes, the correct answer will be narrative theories. Now the next one is the main goal of family counseling and psychotherapy is one of the following. The options are the family therapists aim to change system within which individual reside. Family therapists aim to help families change irrational cognitive perception about family problems. Family therapists aim to help individuals cope within families. Family therapists aim to help families to adapt to the environment in which they live. So these are the options, students, and the correct one will be family therapists aim to change system within which individual reside. Now the next one is consider the process of change in family therapy and the two types of change. At any given moment, counselors or psychotherapists can only bring about one or the other type of change in their clients. First, what is the term for change without change, meaning any change within a system that do not produce a change in the structure of the system? Second, what is the term for change of change, meaning a type of change whose occurrence alters the fundamental structure of the system? Which one of the following options shows the correct two terms? Now the options are second order means change without change. First order means change of change. First order means change without change. Second order means change of change. Third one is temporary means change without change. Permanent means change of change. Permanent means change without change. Temporary means change of change. So these are the options, and the correct one will be first order means change without change. Second order means change of change. The next one is the change. The chapter author discussed three theories that can be used in a brief family therapy format. Which one of the following is not a theory discussed for brief approaches in family therapy? The options are cognitive behavioral, solution focused, family brief intervention, or family system. So the correct answer will be family brief intervention. Now the next one is all of you except for one are limitations associated with family therapy as discussed by the chapter author. Which one of the following is not a limitation of family therapy? The options are the language chosen for describing family systems can be combative, often suggesting willful opposition, double mind, and so on. Family therapy does not pay enough attention to subconscious drive that might fuel family issues. Many family therapy educators and practitioners use this language and adopt a directive, manipulative approach to treatment. Or the last one is family therapists have ignored the different socialization process operating for man and woman. So these are the options, and the correct answer will be family therapy does not pay enough attention to subconscious drive that might fuel family issues. Thank you, students. With this particular narration, you have understood the concept of music therapy and the client couple therapy. Then we have discussed about what is the role of the music therapy when we are dealing with the patients or the clients having suffering from anxiety, depression. Then we have discussed about the couple therapy, what is the role of the couple therapy, what are the aims of that, different techniques of that. So in the next class, we will discuss about other therapies that have been used by the therapist to deal with the patients or the clients. Thank you so much, students. Thank you for your patience listening.